Hi everyone, Dr. Sam Gaston here at North Texas Sport and Spine, and today we're going to talk about a soft tissue technique that we use often in the practice, and that is scraping. So how scraping works is we use these stainless steel tools and an emollient to help decrease some of the friction and make sure we're not pulling the hair or irritating the skin. And then we'll use these tools to scrape along the muscle, across the fascia, through scar tissue, to disrupt those adhesions in there, break up any spots where, again, if there's scar tissue or the tissue didn't heal correctly and we don't have the correct tissue type in there, and you can usually feel that area on yourself, or you feel it on somebody else when you've got these areas that just don't feel like all the tissue around there. So we want to use these scraping tools to get in there, break up that area, break up the adhesion, almost irritate that area to increase the blood flow to that area so that your body can heal it the way it's supposed to. There's various different types of tools. Again, we've got ones that look like this, where we've got a flat blade here, good for big, broad areas of the muscle. And then hooked portions as well, so we can get into tight spots around those bony prominences. You don't want to hit the bone itself, but you do need to be able to get close to any of those areas where the bones are sticking out in kind of odd ways, because that's always where the tendons or ligaments are going to attach. And a lot of times, especially through the tendon, that's an area you're going to want to work on. There's all sorts, again, different shapes of tools. We've got that S-shaped tool there. We've got this one here, good for doing more pressure kind of across a broader area, but it's got points as well, so we can get into some of those tight spots where you don't want to do whole area work, but right across a tendon there. And then we've got ones even all the way up to this size, where you can go across the full quad, through the hamstring, into the calf, and in through the back as well. So again, this is a useful tool to restore the healing inflammatory effect onto the tissue there. A lot of times you'll get redness with it, but that's a good sign. It means that you're bringing blood to the area. Sometimes you can get small bruising called petechia, where it's more blood flow to the area. You've disrupted the tissue in that area, but that's the idea. We want to restore that healing and inflammation so that the body can recover the way that it's supposed to.